infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert and welcome to Outbreak News Interviews. Now, Wuhan City, China has been the focus for infectious disease and public health experts over the past month due to a pneumonia outbreak, where, as the last I saw, the etiology is still not quite clear. News keeps trickling in on this outbreak, but there's still a lot that is unknown. Well, hoping to shed some light on this outbreak today is Daniel Lucey, MD, MPH. Dr. Lucey is a senior scholar with the O'Neill Institute for National and Global Health Law, and he's also an adjunct professor of medicine and infectious diseases at Georgetown University Medical Center. Dr. Lucey, welcome to the show, sir.
Thank you very much, Robert. It's a pleasure to be here.
Now, as I said in the intro, this outbreak has been going on for about a month. So, Dr. Lucey, what do we know about the origins of this outbreak?
Well, the origins aren't definite yet, but the epidemiological link to the infections in people is a live animal market, a so-called wet market, or it's also called a seafood market, in the city of Wuhan, the capital of Hubei province. And
so are experts, yourself and others, are you suspecting this is some kind of a zoonotic disease?
Yes, that's the working hypothesis right now. It is some kind of a zoonotic disease. So it's come from one or more of the animal species that were in the market in Wuhan. That hasn't been proven yet, but that's the most likely explanation, and it's being very actively pursued right now in terms of testing animals that were in the market before it was closed on January 1st of this year, and to see if the novel virus called a coronavirus that's been found now just yesterday in 15 people that are in the hospital in Wuhan and who worked in the market, if that same coronavirus, this new coronavirus, can be found in any of the animals that were in the market.
Okay, and that really leads me into my next question because, as you mentioned, some of the preliminary reports have identified what they call a novel coronavirus. Can you explain to the audience what exactly does that mean?
Sure. So novel, of course, just means new, and then coronavirus is called that because under an electron microscope, the appearance of the virus, it looks like the corona of the sun, if you will. And this would be the third coronavirus that can cause a pneumonia in humans. The first two were the SARS, or severe acute respiratory syndrome coronavirus, also discovered in China in 2002, 2003, in a different province, in Guangdong province, not Hubei province. And the second coronavirus causing pneumonia in humans, of course, is the Middle East respiratory syndrome, the MERS coronavirus that was found in 2012, initially in a hospital in Zarqa, Jordan, then in Saudi Arabia, and then in other places in the Middle East.
Yeah, and both of those viruses do have links to animals also, correct?
Yes, very important point, Robert. Thank you. Yes, so the SARS coronavirus is a zoonotic virus. We think it probably comes from bats originally that infected certain animals, like the palm civet, the masked palm civet, some people call it a cat, and then infected people, and then it spread from person to person and traveled to over 30 countries. Infected about 8,000 people, and almost 800 people died before it was stopped in July of 2003. The MERS coronavirus similarly is thought to probably come from bats, different kind of bat than the one but bats that then infected camels, and then people get infected from the camels, and then like SARS, there's transmission from person to person to person of the MERS coronavirus, although it's not as contagious as the SARS coronavirus. This new virus, this new coronavirus, really just reported yesterday in being discovered and then found in 15 patients in the Wuhan, China outbreak. As far as we know, according to the health authorities in Wuhan and the China Centers for Disease Control, CDC, it's not known to be spread from person to person. So that would be wonderful news, but I think we aren't 100% sure if there's enough information to have proven that there's no person-to-person transmission of this new coronavirus in Wuhan.
Okay, good. Concerning the outbreak, the case count, how large is this outbreak now, about a month in, and what kind of patients are we seeing infected?
Well, the size of the outbreak, as of today, the health authorities in Wuhan have been providing some updates, and it seems to be the case count is basically 59 people, and that's what it was as of reported as of July 5th, 5 days ago, and it hasn't increased. So if that's the fact, then it's very encouraging to me and suggests that it's not ongoing person-to-person spread. Now that the market's been closed, if that was the only source of the virus, then there shouldn't be new cases after that. So all 59 of the cases in Wuhan, I say cases, but of course people things with this fever and pneumonia had a exposure, had a direct epidemiological link to this so-called seafood market or live animal market or wet market in one particular place in Wuhan. So it's right at 59 cases and over 100, and I think it's about 163 potential contacts of those 59 cases, perhaps family members or colleagues or people that were exposed to the 59 cases. They're still under observation, and they probably will be for about 14 days because we don't know the incubation period. In other words, how long it takes after you've been exposed to this novel coronavirus before you might become sick. But so far, none of the 163 have been reported to become sick. So again, that's very encouraging in terms of very little or perhaps zero person-to-person spread.
Now, concerning the pathogenicity, what are these patients seeing? What kind of symptomology are we seeing? And has anybody died?
Well, according to the health authorities in Wuhan and at the China CDC, no one has died of the 59 patients suspected of having, or now at least 15 of them have been shown by a new laboratory test for this virus to have the infection by detecting the nucleic acid of the virus itself, not through any antibody or immune-based diagnostic test. So the pathogenicity, basically the symptoms that patients have, we haven't heard in great detail yet about that, but what's been reported by health officials in China and then posted on the World Health Organization website yesterday, the 9th of January, and then an initial report on the WHO website on the 5th of January is that most of the patients have a fever. Some have shortness of breath or difficulty breathing, and then some have chest X-ray abnormalities on both the right and the left side of the lungs that are consistent with what's called an atypical pneumonia, not the usual bacterial pneumonia. This is more of a viral pneumonia, and in fact, a new virus has been found.
Now, what's the risk of this spreading outside of China's border?
Well, it's a great concern to the neighbors of China, neighboring countries, and to Hong Kong, of course, and Macau, parts of China, but very, very close to the mainland, and they have a lot of travelers from Wuhan, as do many countries, obviously, in Asia, but also around the world. And in fact, just today, the 10th of January, is the beginning of the vacation period for the Lunar New Year, which is in about 2 weeks from now. And many, meaning hundreds of millions, perhaps 350 or 400 million people of the 1.3 or so billion people in China travel for this Lunar New Year. So there's a lot of concern about if the virus is contagious, in other words, can be spread from person to person, that it will spreads throughout China and into other countries. But again, we have no evidence that's been presented from China of any person-to-person transmission. So in fact, if that's true, then really there's minimal likelihood that there'll be spread outside of the country. And again, that assumes that this particular single market in Wuhan was the only source of infection coming from one or more animal species there. And that's the best working hypothesis that we have, or the most optimistic one, but it hasn't been totally proven yet. So I think we need to really have our guard up and be very vigilant. And I think neighboring countries and other countries that aren't direct neighbors in Asia, as well as around the world, are aware of this concern about potential spread outside of Wuhan in China.
So, Dr. Lucey, from where you're sitting, how well are the Chinese authorities dealing with this outbreak, in your view?
Well, I think from a scientific point of view, I'm very impressed with the rapidity with which they've responded, both in terms of medical, public health, but also basic science, the virology, discovering a new virus in patients with an otherwise unexplained disease. Basically, in less than 1 month, it's been reported by the Wuhan Health Commission authorities. They have a website where they update information. From December 31st was the first report, and then January 3rd and January 5th they have updates. And what they said is that the first known or suspected patient with this new coronavirus infection was only December 12th.
Right. And
then the most recent one of the 59 was December 29th. So it's a remarkable, I think, success story from a virology point of view, discovering this new virus, which they did in one of the patients, and they were able to do the whole genome, the full genetic sequencing, and based on that, then they were able to develop a rapid diagnostic test for the nucleic acid of the virus, which means if it's positive, it means you have the virus, you have the infection, and that's basically all been done. I think really just in the last 10 days or so. And so that's remarkable. I think that a couple of things would keep me concerned. One is that there's still, to my knowledge, as of 1 hour ago when I checked again, I haven't seen a sort of a full clinical epidemiological presentation of the data. So some of the questions you asked me, Robert, about what are the symptoms or the pathogenicity, and what do the X-rays look like in detail. They've just given us these summary reports, which I've mentioned, but we don't know that. For example, how long does the fever last? Does the person have any problems other than in the lungs? For example, have any rash? Do they have any kidney problems? Do they have any mental status problems? We haven't been told any of that information, so that'd be helpful to know. The other thing that I think I hope it really should happen very soon, like today, tomorrow, the next day, is that the Chinese authorities in Wuhan hopefully will share the genetic sequence of this new virus, so then the diagnostic test that they have can be applied to potential patients. For example, people traveling from Wuhan with fever and cough to Hong Kong or to Singapore or to Seoul or South Korea or to Thailand or to the United States, for that matter. And so far, as of an hour ago, that hasn't happened. The mainland China hasn't shared the ability to develop the diagnostic tests that they've developed. But all this has just happened in the past few days in terms of developing the new test. And one other very important thing that's happening now is that the Wuhan health authorities and scientists are testing the animals and specimens from the animals that were in the market in the month before it was closed January 1st. To now they know what they're looking for, having found the virus in people. Now they go back and they look for it in the animals, because once they find it, if they find it in animals, then they will go, I'm almost certain, to other markets in Wuhan and test the same species of animals where they found it in that particular market in Wuhan. And then most likely the test will be applied to animals where the virus was found in the Wuhan market, assuming that it is, in places like Hong Kong and Macau and then in other countries. So it's just, in my view, having gone to a lot of epidemics and studied epidemics and taught about them for many years, it's quite possible theoretically that this isn't the first outbreak of this novel coronavirus. It could have occurred in other places in China or outside of China, but it simply wasn't recognized. Perhaps it wasn't as large as this one was, or the country or the city just wasn't, as, how should I say, vigilant and well prepared from a scientific point of view. Wuhan is a very famous institute of virology, so they're quite prepared, if you will, to look for, recognize, and to discover a new virus. So it's possible that this virus has occurred, before December of 2019, but we didn't recognize it. So now when we have a new test developed by the health authorities in China and Wuhan, it can be applied to perhaps looking at stored blood or lung fluids from patients or animals from other parts of China and other parts of the world. So I hope that's a fair summary of answer that question you asked me.
Yeah. Well, let me just go ahead and close with this. Give you an opportunity for any final thoughts on this outbreak or the virus or anything else.
Well, I'd just like to say that this is another example of a new virus, probably that came from animals, so it's zoonotic. It emphasizes what I and many others say should be done to understand and to control epidemics, and that is taking a so-called One Health approach, where you study not just disease in people, but in humans, but in animals, and also in the environment. And so there's sort of three parts to One Health. It's the human health, animal health, and environmental health. And what One Health tries to do is explain why epidemics happen, when and where they do. And also it's essential to understand the three parts of One Health, environmental, human, and animal health, in order to fully stop them, prevent them from happening in the future, or if we aren't able to prevent them totally, to recognize them at the earliest time, which hopefully is exactly what has happened here in Wuhan. So then the last thing I'll say is that now this is the third coronavirus that causes pneumonia in humans. There's SARS, MERS, and now this one in Wuhan. And I would I don't like to say predict, but I would anticipate that there will be a fourth one in the future. Maybe in 5-10 years, maybe in 1, 5, 10 months. But there'll be another one. So we need to develop antiviral drugs, antibodies to treat coronavirus infections in people, and develop vaccines. And we haven't done that for SARS or for MERS, even though they occurred quite a few years ago. Yeah. So we need to do that for the family of coronaviruses. In some ways, we need to develop a universal coronavirus vaccine, just like now we are trying, the international community, to develop a universal influenza vaccine, develop a universal coronavirus vaccine, and antiviral drugs that will treat the whole family of coronaviruses, because this is the third, and there'll be fourth and fifth in the years to come. Yeah. So thank you very much for allowing me to talk with you today and with your audience, Robert.
Hey, Dr. Lucey, let me ask you one more thing. A couple years ago, the World Health Organization coined the term Disease X. Does this fall into that category, do you think?
Yes, I do. It was in 2018, and the World Health Organization, after the Ebola outbreak in West Africa, developed a research and development blueprint, if you will, and focused on particular diseases of highest concern. And so initially they were, list almost all viruses, but then that was around 2015-16. But the 2018 update included what they call Disease X, which means exactly this. It's what's coming, but it might already be here somewhere in the world, but we just haven't recognized it yet. And I divide Disease X basically into respiratory disease X and non-respiratory disease X, because respiratory is the most concerning to me because it's spread through the air. So this is an example, but if it's true that it's not spread person to person and there's no more cases, then this is really almost the best case scenario where an emerging new coronavirus disease, respiratory disease X, was found and discovered within less than a month of the first patient being recognized, and hopefully stopped. And hopefully this will be a strong catalyst to develop, anti-coronavirus drugs and vaccines. So yes, this is an example of disease X. What most of us have been fearing is that the next disease X will be more like SARS, that had traveled to more than 30 countries and had a 10% mortality rate, and or something worse than that. And the phrase to describe this worst case scenario, the term is a rapidly spreading pandemic due to a lethal respiratory pathogen. That's a quote from the September 2019 Global Preparedness Monitoring Board, which is a very high-level group of renowned people from around the world. There's 3 of the 15 people on the board are from the United States, so most are not from the United States, and the 2 people that co-chair it are not from the United States. And they presented their report last September at the United Nations General Assembly in New York City, and they said that certain things have to be done within 12 months. Before September 2020 to prepare for this disease, if you will, rapidly spreading pandemic due to a lethal respiratory pathogen. So that's where we are in the world right now, and I think that finding this new coronavirus in Wuhan is really a very positive step in terms of the rapidity with which it's been done, but there still remains a lot more to do. Find the end source, share the diagnostic test and the genetic sequence with the world, perhaps with World Health Organization. And as a clinical doctor, I think the most important thing is to come up with treatments, and for this virus, but for all coronaviruses and for a vaccine, a universal coronavirus vaccine. So again, thank you so much, Robert, for your time, and it's been a pleasure to talk with you and with your audience.
Well, thank you very much, Dr. Daniel Lucey, for giving us your expertise and your perspective on this outbreak. I appreciate it, sir.
Thank you, sir.